So, I want to talk to you today a little bit about what I consider to be therapy and what you might expect if you came to my practice. So, first and foremost, therapy can be done in so many ways. And I've been trained in quite a few what we call modalities or way of doing therapy with people. So, my favorite and the one I like to work with the most is narrative therapy because it allows a person to talk about their story and through that story, finding out what worked, what didn't work, what patterns are involved, how to overcome some of the hurdles and undo maybe some of the damage that we've experienced in childhood, unbeknownst to us. So I really like working with narrative therapy, but I'm really open to exploring all different kinds of therapeutic interventions. So, what can I tell you about what I think would be a good thing for you to do to find the right therapist for you? I've put a page on my website called Finding a Therapist, so I definitely recommend you have a look at that. But the two things that I consider really important when looking for a therapist is that you want to find someone who has done some work on themselves. In other words, they've done some therapy and they've learned. Because if your therapist hasn't done the work, you run the risk of being the victim of their projections or their transferring their unhealthy habits onto you because they haven't done the work themselves. A good therapist will be open to you asking questions to help you sort out your concerns and even asking questions about the type of work they've done on themselves. So I really recommend finding out and learning if your therapist has done the work on themselves, number one. Number two, uh, I am a social worker, so I have been registered with a couple of regulatory bodies that keep me ethical in my practice, which means I'm going to be monitored yearly to make sure that I'm not doing any harm to people. And they have a way of screening me every year and looking at the work that I've done on myself and continue to do to provide better service for my clients and to keep me honest, ethical, and not producing any kind of harm. So the two regulatory bodies I belong to are the Ontario College of Social Workers and Social Service Workers and the Ontario Association of Social Workers. If I was not registered with those bodies, I wouldn't be able to call myself a social worker. So you want to make sure that the person you're receiving therapy with is registered with some kind of regulatory body that keeps them honest and ethical.